My name is Sam Meisler, and I'm a small animal veterinarian. Let's talk about dog colitis. First of all, what is dog colitis? Simply put, dog colitis is inflammation of the colons. Now, the symptoms of colitis are, the number one symptom, of course, is diarrhea. But the type of diarrhea is very important. Often we'll see mucus in it, and sometimes we'll see blood in it. But the biggest giveaway is there's a definite sense of urgency about it. These dogs cannot hold their diarrhea till it's appropriate to go out. They will have accidents in the house. They'll have a definite sense of urgency where they have to run to the door and get outside quick to go to the bathroom. They may go and have diarrhea on the way to the door. It's a definite sense of urgency. That's a big clue that we might be dealing with colitis. Now, of course, when they're actually going to the bathroom, sometimes we'll see a lot of straining associated with colitis. Straining before the bowel movement, during, and afterwards. Their colon and the rectum is inflamed, so often they still think they have more to come out, and they'll keep going, almost giving a symptom of constipation. But straining is the key here. So straining, sense of urgency, mucus in the diarrhea, blood in the diarrhea. Any or all of those symptoms point to dog colitis. Now, what causes dog colitis? Most of the time we don't know. And when we don't know, we call it idiopathic colitis. Sometimes it's stress. We have a lot of stress-induced colitis in dogs that board in kennels or have a change in environment, new person in the household, any kind of new things like that. You may want to think that that would be the trigger, and it's a stress-induced colitis. If we can get rid of the stress, then you can keep the colitis away. We'll often see a parasite-induced colitis caused by whipworms, and that can be diagnosed with a simple fecal test. We look for the whipworm eggs. Another cause is a dietary hypersensitivity. A lot of dogs that have continuous bouts of colitis, month after month or year after year, then that is something to think about, that maybe it's something in the diet that they're allergic to. And what that involves, as far as trying to come up with a long-term solution, is to go to a novel protein, go to a protein that they haven't been exposed to before. If they're on a beef or chicken predominantly diet, then go to a salmon diet or go to a duck diet. Sometimes it involves changing the carbohydrate source. Those are all things to think about. Even going to an additive-free diet. Some additives in the dog food, some preservatives may be causing the colitis, so that's another thing to think about. When we have a dog colitis present at the clinic, usually it's a sudden thing that's happening, and we have to deal with it right then. We're going to go ahead and treat with medications that will temper the inflammation in the colons, and then we're also going to treat with antibiotics, because a lot of times when you have an upset bacterial balance in the colons, you'll get a bacterial overgrowth, and we'll want to treat that with antibiotics. And then we usually send dogs home on a bland diet, very low fat, something that's not going to upset the intestines until they can get back to their normal diet. But think about these possible causes, because you may be able to prevent a long-term bouts of colitis by getting rid of the stress, possibly changing the food, or adjusting your pet's surroundings. Gives you an idea about what to do if your pet, or if you think your pet, has dog colitis.